Welcome to the Read, Talk, Grow podcast, where we explore women's health topics through books. In the same way that books can transport us to a different time, place, or culture, Read, Talk, Grow demonstrates how books can also give a new appreciation for health experiences and provide a platform from which women's health can be discussed. At Read, Talk, Grow, we use books to learn about health conditions in the hopes that we can all lead happier, healthier lives. I'm your host, Dr. Denise Millstine. I'm an assistant professor of medicine at Mayo Clinic in Arizona, where I practice women's health, internal medicine, and integrative medicine. I am always reading and I love discussing books with my patients, my professional colleagues, and now with you. Our book today is Weathering: The Extraordinary Stress of Ordinary Life in an Unjust Society by Geronimus, through which we'll be talking about the concept of weathering, especially the health effects associated with chronic stress among marginalized populations. My guests are Geronimus, who is a professor at the University of Michigan with appointments in the School of Public Health and the Institute for Social Research, and is affiliated with the Center for Research on Ethnicity, Culture, and Health. She's an elected member of the National Academy of Medicine. Dr. Geronimus received her undergraduate degree in political theory from Princeton University, her doctorate in behavioral sciences from the Harvard School of Public Health, and her postdoctoral training at Harvard Medical School. She's the winner of many awards throughout her career and recently is the 2022 recipient of the James S. Jackson Distinguished Career Award for Diversity Scholarship from the National Center for Institutional Diversity. Dr. Geronimus originated the biopsychosocial theory of weathering that we'll be discussing today and is the author of the book, Weathering: The Extraordinary Stress of Ordinary Life in an Unjust Society. Dr. Geronimus, welcome to the show.
Thank you very much. Thank you for having me.
Dr. Sumedha Penheiter has a doctoral degree in biochemistry and genetics from the University of Nebraska-Lincoln. Her postdoctoral work at Mayo Clinic was focused on cancer biology, where she researched signaling pathways in carcinogenesis. Subsequently, she worked as a program manager within research administration at Mayo Clinic with a focus on health disparities research. Currently, she works as a manager and consultant within the Mayo Clinic strategy department, where she advises on strategies for optimization of systems and procedures using the agile and waterfall management methodologies. She's also the president of the board of directors of the Rochester Diversity Council. Sumedha, welcome to the show.
Thank you. Great to be here.
So once again, our book is The Incredible Weathering: The Extraordinary Stress of Ordinary Life in an Unjust Society. And this book came onto our Read, Talk, Grow radar when we were talking with Linda Villarosa, whose 2022 book, Under the Skin, had a lot of accolades. As you know, Arlene, you were featured in her book and she is featured in yours. And we were so excited that she put us in contact with you and we got to read your book, and here we are. Arlene, let's start with a definition of weathering, which is something that you actually created through your work and your research. So weathering posits that the health of African Americans and other culturally oppressed, marginalized, or economically exploited populations, their health is subject to early deterioration as a consequence of social exclusion. You've worked on this for much of your career, but talk to us a little bit about weathering, how we can understand it, what it looks like.
Weathering is the way that oppression and marginalization physiologically erodes your body systems, your organs, and eventually you, leaving a weathered person vulnerable to infectious disease, to early onset of chronic diseases like hypertension or diabetes or even obesity. It's a function of the fact that people who weather are people who are facing structural barriers to making ends meet, or to being seen or heard, or to being able to meet all their responsibilities, but who struggle tenaciously to do so anyway. So I named it weathering because of those two things. One, weathering, like the erosion of your blood vessels and your body systems and the literal physiological damage that happens to your body if you're a member of an oppressed population, and also because members of oppressed populations work resiliently to survive or overcome their oppression. And that can be weathering too. It's shelter, that engagement, it's what allows them to keep working, to earn money, to go to school, et cetera, to work several jobs if they have to, or night shifts. But it also they pay a physiological price for that as well that contributes to weathering. So it's both shelter and storm.
I love this. I think it's so powerful. When I think of weathering, I think of a tree at the edge of a cliff that's all, has that character, that gnarled, and it's survived and it's resilient, but that's come at a cost. So there's both a beauty and also a price in it. Sumedha, in your work, you have seen this concept, whether you called it weathering or not, no doubt.
Sure. Just out of personal experience, if I may add, I was born and raised in India, and I moved to a small town, in Lincoln, Nebraska, from where I was, Delhi. You feel so othered in the sense that there's a dominant culture, and having been in a culture where there was more of a caste system rather than a dominant culture versus a non-dominant culture, you just feel like a fish out of water, and you're always putting your A game on, your best foot forward. I've spoken to other colleagues, people of color, and they feel very uncomfortable stepping even out to the grocery store without having, a proper suit, perfect hairdo, perfect makeup on, because they feel that they're judged all the time. My husband, who's white, when he has to go for an early morning blood draw, feels very comfortable just walking in his sweatshirt and pants and just drawing his blood. And I feel that I will not get that respect, or I just have that inside of me, the consciousness that I need to look good to be respected. And so this ever vigilance that you feel because you are not part of the dominant culture is so exhausting, and it's always on. That really wears you down. Notice that a lot with other cultures, especially people of color that feel that they're constantly being judged, and they're always walking on eggshells, it feels like, when they are out in public. And that has an allostatic load, as you pointed out, Arlene. It raises your blood pressure. You're constantly on fight or flight mode, and that really wears you down, or weathers you down, as you said.
The physiological consequence of being vigilant all the time, or what we also call managing your social identity or code switching, the various ways you do try to put on your A game and do what you need for the people around you to respect you and not to fear you in some cases. For a professional woman, maybe it's you want some respect and voice and be taken seriously. If you're a young Black male like Tyree Nichols or George Floyd, it can be a matter of life and death, whether you're viewed as a threat or fitting any stereotype, negative racist stereotype. In either case, you do suffer physiological arousal. It may be greater or less great, depending on if you're literally fearing for your life or just trying to be respected and seen. But that kind of chronic being, what you called in fight or flight, for example, wears down your immune system, your neuroendocrine system, your metabolic system, your cardiovascular system. And it's that constant wearing down of those that can lead to early onset of hypertension and diabetes, or to being more susceptible to COVID, or to dying from COVID at a younger age, when members of, as you called it, the dominant group don't die from COVID much if they're under 65, but it happens much younger to people in oppressed and economically exploited groups. And it's just this constant vigilance. Again, if you're a young Black male, or you're in certain settings where you're actually could be viewed as threatening, it's not just vigilance 1.0, it's like vigilance 10.0, as in having your head on a swivel all the time and being acutely sensitive or look unthreatening And then it also can be added to by other kinds of stressors, the ones we think about, having to work night shifts, having to work 2 or 3 jobs to make ends meet, never having a break, having to stand out waiting for the bus. And in this frigid weather we're having now, and the bus comes late, having then to stand on the bus packed like a sardine, and then to get to your job, which might be physically taxing or emotionally taxing, and where you also have to be managing your social identity and being sure you're being, polite and looking respectable, etc. And one last one I'll add is, if you're exposed to environmental toxins, they can be physiologically stressful. So the idea of weathering is that people who face those stressors chronically, fight or flight we're really adapted well with fight or flight to a very brief period of being attacked by a cheetah, after which we either flee and escape or we're killed. Either way, within a few minutes, we no longer need to have our heart rate up so that we can get oxygenated blood to our large muscles so we can run or fight fast, better or faster or stronger. And we can just go back to our normal state of physiological being. But if you have fists in your face at every turn, if you're not able to have any time to recover because you're always managing your social identity, or because you're having to work 3 jobs because your wages are so low, then that's where the erosion comes, because the stress hormones that sort of regulate your flight or fight response just never recede the way they were meant to after about 3 minutes if you survived the ordeal.
May I just jump onto that, regarding the safety part of things? I agree with that completely. When I was a graduate student, the World Trade Center was bombed, and Middle Eastern women and Indian women, to a person who's never really traveled, looks the same. And so we were so scared, because that did happen, that someone from Indian origin was thought to be Middle Eastern and was shot in Kansas, which wasn't too far away from Nebraska, that we were very, very careful and really avoided going out in grocery stores during daylight hours. And these were all PhD students that were getting their degree. I know that after 9/11, there was a study that came out where they saw that Arab women after the 9/11 event had a lot of premature babies, or babies that had low birth weights as a consequence of this chronic stress. So yes, felt a little bit of life being threatened too. And that is definitely eons above the constant worry of how you're perceived.
And the study you're referring to was of women in California. So it wasn't even anyone near where 9/11 occurred. So it was just through the learning about it and understanding through the media how unsafe it was at that moment to be perceived as Muslim, whether you were or weren't, or whether you self-identified that way. Now we see that with some Asians, for people who have started to feel Asian hate, because our last president referred to COVID as the China virus, and as if China had somehow given us this horrible pandemic. People don't make distinctions based on whether they know your history is that you were literally of Chinese heritage, or from, if you're any one of the so many other Asian groups. And that's a key point too, because it's your social identity. It's not necessarily what you feel as your identity, but it's how people see you or might see you. And that's what you're talking about with the Indian women after 9/11. You first of all probably knew that no one should have just lumped all Muslims or Arabs together as threatening. That made that social identity very unsafe. But people went even further, and just anyone who had a physiognomy that they would interpret as possibly Muslim was also under threat, literal threat, as well as psychosocial threat. I think weathering is sort of that piece that explains how we link sort of systemic and structural racism to inequities in health. because it's through the fluency, it's through this, on the one hand, of the dominant culture, either erasing other cultural ways of being or misrecognizing them and stereotyping them, devaluing them in any case. And it's through the people in the more marginalized groups that they are fluent in knowing that that's how they're seen in this new culture that they're in, or the culture they were born in if they aren't immigrants. That's what makes you vigilant. And that's what makes you, it's your knowledge of how you think the dominant group sees you and others you that kind of triggers the vigilance that then can mean your survival in some circumstances or advancement in some professional circumstances, but also means that your body is constantly under the impact of cascades of stress hormones that wear down your health.
I want to jump in here and put a plug in for the book, which, because the two of you have used so many phrases that can be confusing to people or even new to people who are exploring the topic of weathering and related topics, I think you do an amazing job, Arlene, in weathering, talking about othering, and you call this chronic awareness, being a chronic vigilante. You give names to these situations that I really appreciate, allow for the ability to then discuss them and sort of move them forward in as much as recognizing them and hopefully creating awareness so that there is change. A couple of the other terms that we saw in the book are age washing. Can you talk about that?
Not only do I think weathering is important to think about in terms of population health, because it's sort of a new concept that I think contributes some new insights, but I believe part of what dominant culture has done and part of what creates systemic othering of certain groups is it points to all the wrong things. When people are trying sincerely and well-meaning to come up with policies or programs to reduce the health disadvantages that oppressed groups suffer, they come up with the wrong ideas. And that's because we're living under a variety of dominant ideologies. And one of them is what I call age washing. And what age washing is in general is this idea that the only thing that leads to poor health or early aging or disability is that if you don't take care of yourself, that we're all capable of just going through a developmental set of stages from fetal life, infancy, childhood, adolescence, then your prime adult ages, between, maybe 18 and 64 or 65. And then we deteriorate more and experience senescence and aging. And that's what we've been age washed to believe, because certainly there are developmental processes, and you especially see that in kids who are growing, and it's quite clear in the old, but they are not the only thing that contributes to your health. And in an age-washed world, when we see that some groups of people or individual people have worse health or die young or get what we call pre-existing conditions or become obese, we think it's something they did as an individual, because the idea is we've been age washed that your body would just naturally go through these stages, and you'd have this several decade period in your 20s, 30s, 40s, 50s, where you're in your prime of life. And so when you see populations who are dying in their 20s, 30s, 40s, 50s, or who become disabled, or who develop hypertension or diabetes in their 20s or 30s, we think as individuals, they must be doing something wrong. Now, if we're generous about it, we might say they don't know better, or we could teach them, give them health education, or maybe it's there's not enough grocery stores with fresh vegetables in their community. All of that is part of it. But the less generous way age washing gets used is that you must be from an immoral group or a lesser group who doesn't take the time to have future orientation, who aren't personally responsible. What weathering highlights is what makes certain groups of people more likely to have shorter life expectancies or shorter healthy life expectancies is the way society treats them, not how they as individuals treat themselves. And in fact, to the extent they try to overcome, as I mentioned before, all the barriers in their way and are actually acting what we might recognize if we looked at it as very responsible people and self-sufficient or caring for their families, is part of that storm of weathering. So I feel like the idea is very limited at best and just wrong, and actually 180 degrees wrong at worst.
Sumedha, I can imagine in your work at Mayo Clinic and looking at health disparities, this is a concept you're very familiar with.
I completely agree. I have seen this in a lot of research studies where sleep deprivation, especially in the Black community, is a big factor that affects how fast people age or get sick. In general, I can just share from my personal experiences really quick, if that's okay. During the pandemic, there was talks of furlough at Mayo Clinic, and all the health institutions were in the middle of not knowing what comes next. And my daughter, who was a 2020 graduate at the time, developed, unfortunately, an eating disorder. And we had my parents living in India, who I could not reach out where the pandemic was at its worst. And I exercise, I eat well, I do everything right. And lo and behold, I didn't even realize the chronic stress, not being able to sleep at night because we were constantly worried about how this virus is going to affect us and our futures. I developed Graves' disease. And, that's something that just came out of the blue. And since then, it's been a cascade of health issues. So it's the same for a lot of people who are overweight or obese, that you just assume in a lot of work, the fat stigma that was there in the research that I've overseen or supported through projects, that people are blamed for their own doings because they are not taking care of themselves and they're bigger. And that was a big thing, that fat shaming or stigma or bias around people that are overweight. Kind of, it's a vicious cycle that led to people feeling alienated from the health systems because they always felt judged by the medical providers as well as their peers. And I know people who work out and do everything right, and for some reason, their biochemistry or metabolism is just not conducive to being this super skinny athletic body type. So definitely saw a lot of that, causing overweight people not to be part of the health system or wanting to use the health system because they always felt judged, which then in turn has a negative effect.
I think it's important to look at that. And for our listeners who might not be familiar, Graves' disease is an autoimmune thyroid condition. And, you might think of it as just being random or mysterious, but you can see that in a state of chronic stress, you're going to be more susceptible to these chronic illnesses. And they're not necessarily the ones that you or we in the healthcare community tie directly to lifestyle factors. In your book, Arlene, super impressive statistics about the number of chronic diseases in women. In your book, you say women of color have an average of 4 or more chronic health conditions by the time they reach age 50, and Black women, 60% of them have hypertension. By the age of 45, these are not older women in, I guess, my age-washed perspective, but really this is a very young age point to see more than half of them. More of them are hypertensive than not. The impacts of this is just enormous.
Yes, and if they're hypertensive, they're likely to have other morbidities or develop them. Instead of thinking of hypertension as its own unique disease, to some extent you need to in terms of treatment. But if you think of it as a reflection of being weathered, it means that other body systems have also probably been dysregulated. Autoimmune disease is a perfect example, actually, which is very weathering related, because the dysregulation of your immune system that happens with the kind of accelerated aging that is triggered by weathering leaves you very susceptible to either not surviving infections or surviving them, but then going into overdrive as your immune system tries to do its job in the face of its being dysregulated and weakened. And that is a source of autoimmune disease. I often thought, and I mentioned this in the book, that one reason that you saw so many more COVID deaths among Black women or Indigenous or Latinx immigrants, for example, was that most people weren't seeing, was this idea that if they got COVID, they either might have had weathered immune systems that led them not to be able to rally, or they had dysregulated immune systems that led them to rally too much, which would cause those cytokine storms that often precede a COVID death. There are many other reasons. They were more exposed to COVID because living, doing those sort of front-facing essential jobs, taking public transportation with others who were also susceptible, living in overcrowded housing, doing jobs that themselves, Latinx women and men, often in the Midwest at least, work in
crowded facilities.
Right, that are not ventilated well and where people are standing very close to each other and handling everything as it goes down the line. So certainly those are very clear structural ways that kind of are segmentation of the labor market that puts people of color more often in not just low wage jobs, but ones that are actually very stressful or unhealthy or toxic. But it's also, if those things happen on top of being already weathered to some degree, then you're susceptible to a worse infection or to cytokine storm as you try to deal with the infection. And before COVID, weathering could also explain the earlier ages and the much greater prevalence of autoimmune diseases among oppressed populations.
And in the book, another layer, not that there needs to be more layers to make this so challenging, but another layer is this issue of being slow to treat oppressed communities. We would really love to believe that the healthcare approach is equal for whatever patient is in front of us, but you provide very distinct examples of women who are famous, of women who are resourced and educated, who have outcomes that are frankly shameful. Serena Williams is one of the people that you talk about with her complications around her peripartum period, which she has been public about, but obviously she has more money than the vast majority of Americans and is a strong woman who is very smart, and yet her diagnosis was delayed and fits, right? Mm-hmm. So this being slow to care, I think, is an important layer for us to be honest about.
And she was slow to be diagnosed of the blood clots that had gotten to her lungs, even though she had had blood clots before. And pregnant women are at higher risk of having blood clots, even if they didn't have blood clots before. So it seems like everything should have been screaming to her caregivers that this was a risk. And if she's having these symptoms that she recalls from when she had her blood clots before, they should take that seriously. But it took all the tenacity she had and just refusal to give up, and probably her resources and being in a very good hospital, that finally, in effect, saved her life. If she had been anybody else, she probably would have died.
So clearly there's a problem. Clearly there is an effect that we're under-recognizing at best, or not recognizing at all. The idea of chronic stress and how we can manage it and develop systems and support structures that recognize the realities of this and try to rework our approach and the chronic stress that we're putting people under as a society. Sumedha, a lot of your work with professional organizations and within Mayo Clinic really looks at restructuring these systems and what we can do. Can you talk a little bit about the hope on the horizon?
I think the first thing that we've all done is to recognize that there is a situation. That is definitely what we've done. within strategy, we've developed a resource guide that I have actually led, where we really have the consultants look through this equity, inclusion, and diversity lens when consulting on projects, be it facilities, be it digital health, be it health literacy. And so, that's just small steps in the right direction, but just understanding that one size fits all is not the answer, and the greatest good for the greatest amount is not always helpful. And just really thinking of those that slip through the cracks, or the underdogs, and how you can specifically, by just few modifications, be more inclusive in your consultations of designs of, be it facility, like I said, medical care, telehealth, just a lot of things that don't require a lot of tweaking, but then are very inclusive. And then putting that in, making that over to policy, especially where access to care is the biggest problem. And it has a simple fix, where there's hospitals and healthcare systems that have partnered with Uber, so they can bring patients in where they don't have transportation, rather than having to go through 4 bus changes that a lot of people in big cities have to do through chemo, and fighting with insurance companies to cover that transportation cost. Having daycares in areas where you have stay-at-home moms that have to come in for their health care but can't because they have these children, so again, lobbying to make sure that these social determinants of health are addressed. So that's kind of the first step in right direction. I'm also working with the Minnesota Cancer Alliance. I'm their vice chair. And right now we're just lobbying at the Capitol to make sure that certain amounts of biomarkers that are standard for a lot of insurance companies coverage, if you have private insurance, are also covered by Medicare and Medicaid. And so really improving access and lobbying without it thinking of it as a handout has been the big policy approach that's been used.
Arlene, I think you finished the book really with that push for equity, which I think is a lot of what Sumedha is talking about. Can you comment on that?
One of the things that I think Weathering lays bare, or watching George Floyd be murdered, or Tyre Nichols, or any of the ways that racism either kills you stealthily by weathering you, or through actual violence and immediate death, happen because we're not putting as a prime value in figuring out policy, whether it's policies in schools or policies in hospitals, or big policies from national policies, how important it is to be equitable, to realize who is suffering the worst and needs the most help, who isn't. Instead, we have ideas about profit or as the values of how to make things work, or efficiency. And one of the lessons of Weathering is that if we don't take equity into account, that's not just a kumbaya moment, but if we don't take equity in terms of really seeing what people need and what they're dealing with and how hard they're working to deal with those things every day, people will continue to weather, and will continue then to lose a lot of our human resources, to cause major injustices, and to have a healthcare system that's unsustainable for anybody. For our healthcare system to get out of the trouble it's in economically, and to stop costing so much, we have to have fewer people be sick. And weathering is a very big part of that sickness. And so we have to take equity into account, and it should be front and center.
I love that as a place to wrap up. We need to have fewer people be sick. And I really appreciate both of you for your work in raising awareness and connecting the dots, helping all of us to understand how chronic disease happens among various populations, and that we can hopefully change our systems to make the world healthier and better moving forward. Thank you for being on the Read, Talk, Grow podcast. It was fantastic to talk with both of you.
Thank you.
Thank you. It was a pleasure being here.
Thank you for joining us to talk books and health today on Read, Talk, Grow. To continue the conversation and send comments, visit the show notes or email us at readtalkgrow@mayo.edu. Read, Talk, Grow is a production of Mayo Clinic Press. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. The podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented is not intended as medical advice. Please contact a healthcare professional for medical assistance with specific questions pertaining to your own health if needed. Keep reading, everyone.